It is a program for veterans in the VA that it kind of covers the gray area between they're wondering if going back to work, whether it's full-time or part-time, is a viable option, and actually getting to that point to where they're ready to look for and apply for competitive employment. So what we do in the transitional work is we have agreements with different departments throughout the VA hospital. And when the veteran comes to the program, we actually place them in a real-world work environment with one of these departments. So it gives the veteran an opportunity that may have a mental health issue, a physical disability, or emotional disability that is causing them, it's either presenting them a barrier or presents an obstacle that either keeps them from maintaining their competitive employment, or it causes them problems to where it's hard for them to obtain competitive employment.
Vocational rehab is helping individuals look for employment within their vocational interests and abilities. We help them recognize that even though they have some barriers that may limit what they can do out there, that they can obtain employment and really be successful and maintain the kind of work that they want to do.
Well, I was having issues with anxiety. And I felt I needed to go into a program that would help me with my anxiety or help me try and cope with coping mechanisms to where I can cope with my anxiety in the workforce or with people, you know, and it was a pretty good program.
Well, I went through the CWT program because when I was in the military, I was part of something bigger than myself. And unfortunately, when I was in the service, I had lost somebody that was very important to me, my mom. And when I got out, I was completely lost. I didn't have much family after I'd lost my mom, and just dealing with some of the things in the civilian world, and just without the support from the military and all of my battle buddies and everything else, I just wasn't sure of where I was going to go. So I came to the VA to come to cover my healthcare needs. When I got there, I found out about the CWT program. There I found that they would help me with various aspects that I felt like I was lost.
I was having some mental health issues. And instead of being on the outside, I see my doctors. I work, and I'm here in the hospital with veterans, other veterans, and it's all part of the therapeutic program to help with my mental health. I definitely have a better outlook on life, and I understand my mental health a little bit better, along with medication and the veterans and the other staff. It all comes together to help breathe and move around a little easier after PTSD and the depression and anxiety and panic. This is a really stressless environment, and it's really therapeutic, and it helps me be able to move around and breathe easily on a regular day-to-day basis.
I was able to talk to other veterans and make a connection. I was able to talk to other people that, frankly, they've lost other people in their own lives and how that has impacted them. I was able to use it with the CWT program. It's helped me build up my confidence, my workplace ethics, and my ability to effectively communicate with individuals who are going through a hard time, and just being able to listen to them and realize what it feels like to have somebody really care and show compassion to you when you've gone through something really rough.
Well, it helped me out as far as work-wise goes with people and stuff like that, and you know, my anxiety persists in getting worse and worse and worse. But the program was a very good program because it helped me cope with people and my and the ability to strive for the best I can strive for.
This program is important to veterans because it gives them a chance to work themselves back into the workforce, build up their stamina, possibly rebuild their self-worth, give them a purpose again, give them that structure, but it does it in such an environment to where they don't have to be worried about losing their job while they're in this program, because they're not really employees. They're actually outpatient veterans, patients that are in a work therapy treatment program. So it kind of takes that weight off their shoulders, and it allows them to actually work through the issues that they're having that cause them to not be able to find the employment that suits their needs or be able to maintain it. So that's why it's pretty important to them.
It's a way for the community to give back to the veterans for serving for their country. Some of the individuals that come back from the service have difficulties in a lot of areas based on some of the experiences that they had. So it's a really good way for the community to kind of give back to them and show support to what they've done for them. And as far as for the veterans, again, it's just the benefit for them. A lot of them, when they come back, say that the most important thing to them is continuing to provide for their country and their families. They have great work ethics, and they just want to give back to society.
The CWT program is very important to us as veterans because we're able to see the shortcomings in our own lives, and sometimes we might not even recognize it. We're able to talk to people that do this professionally. They're able to help us with various aspects of workplace environments. They're able to help us with effective time management. They provide classes of how to budget your money wisely, everything from building your interview skills, helping you with your resume and application, how to navigate something as important as USA Jobs if you're interested in finding a federal position.
Give it a try. I would 100% give them the thumbs up to enlist in the program. It's very helpful, and there's so many people that's done it way before me, and there's a good majority of folks here that have gone through the program, and it helped them, and they're still here. And yeah, it's just great for the veterans.